Health Education Lecture Series. All the listeners of Health Education Lecture Series, welcome to my show. I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. I'm here to deliver your next lecture for the eye, though we have still pending of toddlers' age problems, toddlers' age development. But after this one, we will continue with the routine of that one. But this was the question that what are the reasons behind dimness of vision? So, to clarify dimness of visions, in my last lectures, I have explained the parts of the eyes and their function. What, what are the parts of the eyes and what are their functions? And mostly, when you know the parts and when you know its functions, from there you can well imagine if ever there be any defect in the visions or in the function of the eyes, it will be because of this organ, because of that organ. Because we know the functions of each and just like conjunctiva, it's the coverage outside the coverage. Cornea, it's the inner coverage. You can say the outer covering of the eyeball as a whole eye, but it's the under the conjunctivas. That's the layer. So conjunctiva and cornea, these are mainly the two layers which are covering and protecting the eye from outside. And we have discussed about the muscles to keep the eye in a position. There are many more problems in the eye when the eye is not focusing normally, and if the eye is not focusing normally, vision is not correct. There are different kinds of visions. We will discuss one by one all these things, and sometimes the inward estropia or exotropia and all these things. There are many more other things we will describe time to time, and that what are the reasons. And some of the, because there are six muscles which are binding the eye into its position and keep the eye into in its positions. But if any one of the muscle is weak, the eye is retracted to the other side, and the focus of the eye will not remain same. And if the focus is not remain same, ultimately the vision will not remain same, and the vision will not remain same, the quality of the vision will also be harassed or damaged, impaired. Therefore, we have discussed yesterday all the six muscles, all the six muscles of eye: superior, medial, lateral, and inferior muscles. And two muscles were oblique muscles. So, from surrounding of the eye, from the circumference of the eye, you can say the eye is situated in the orbit, and in the orbit there is a round circle ball, and that ball, properly the eye that has different parts, and those different parts are covered into the cornea, and the cornea is covered by the conjunctiva. So all these are the muscles which controls the movement of the eye, which makes it fix for the vision, position in the eye. And after that, we have discussed about the lens, that this lens is a different one. Sometimes, if one lens is concave from one side, the other lens is convex from the other side. But this lens has both way concavity, both sides, in front side and the back side. It's a concave lens, both sides. So that I explained it yesterday that if the light goes from outside and it's transmitting the focuses of the objects and into the one concavity of the lens, and ultimately when it goes to the other side, it again enlarges. First of all, from the enlarged vision, it becomes smaller vision when it passes from the whole of that that lens, and ultimately the small portion, the central portion of the lens, because it's transparent. And ultimately, when it goes to the other side, it again flares up. But to control the flaring of this one, macula is a part of the eye which controls its yellow color of membrane. You can say is yellow color of substance, and it do not allow the vision to flare up. It focuses it focuses and the objects whatever is coming up in the rays will go in the straight lines and in the actual position and the actual size of the object we can presume in the back sides in this way. And the retina, this retina is, you can say, covering the eyeballs, that the black thing, you can say, black thing in the eyes, it is surrounded by the white portions, that is conjunctiva, that's the iris and retina. So all these things are different two colors, the dark black and light black. The dark black is a hole, you can say, through which the light goes in the backside and the vision goes to the optic nerve, so that it can go to the brain and we can presume that what we are seeing. So this is what, and after that I have already described you yesterday the vitreous. Vitreous is also a part of the this whole substance of the eye, which covers the macula. I told you the macula is the part behind the lens, which is concave on both sides, so that the light of the object should not shred it. It should be in a closed circuit, and that portion is known as vitreous. Sorry, macula. And the macula is covered, it should not flare up. Macula itself should not flare up. It is covered by the vitreous. So this was the condition I have told you yesterday in our previous lecture. It was the first, just an introduction lecture about the eyes, that this is the eye, and mostly for the general public there are big description of each and every part, and about their functions of the parts. But in a short view, just every person should know, a layman must should know about his eye, that what is in the eye. If ever anything happens, he should know that where it may be, what part of the eye may be wrong. That is why I am not having proper vision. I am having diverted visions. I am half visions. I am having upper vision, lower vision. And there are different kinds of the visions. And because of the weakness of the muscles on that sides. So we name all these parts are the diseases of the eyes in a different way, and then after that the doctor treat accordingly. Whatever is wrong over there, they try to correct it. When any doctor, any patient of eye goes to the doctor, to the eye surgeon, to the eye specialist, whatever, his main question is surrounding around the vision. My vision is dim. I'm not seeing normally. This is the main question in the ophthalmology departments. Everybody goes over there for the vision. Vision is vision is normal, then I don't think there is any big problem to go to the surgeons or go to the doctors. So vision is not normal. Just the simple thing, inflammation, conjunctivitis, inflammation due to some other environmental changes, and due to something which has gone into the eyes in the soft area, and it has created irritation inside that may cause some local type of problems, and ultimately those local problems mostly go in a short while, if otherwise the eye is healthy. But if eye is not healthy internally, something's wrong with this structure, something's wrong with this functioning of the structures, so then that may be a little serious thing, that need to be discussed with the doctors. And whenever go to the ophthalmologist, you told your story and he explains this thing, that why it is and what we can do for that. Or in this way, and today I will give you what are the reasons behind dimness of vision, impairment of the vision. It's not normal. Normally the vision is considered as 20 by 20. But if vision is not measured like that one, whatever the standard measurement of the eye ophthalmology department is, if it's not measuring that 20/20, it means something is wrong, maybe functional, maybe because of any part of the eye is not working normally. Functional means temporarily anything has happened, and that causative factor, if it is removed, then ultimately our vision returns to normal. Person do not feel that. Just like a smoke, just like sand, just like something go inside the eyes, it causes irritations. And ultimately, when this thing is irritation, causing irritation, watery eye, itchy eye, all these things are redness of the eyes, all these things are mostly temporarily caused by some other exciting factors. And those exciting factors, I already told you, the hot air, the cold air, the dust, the smoke, or anything if instrument has gone inside the eyes, just like sand and all that. So that may cause the dimness of vision, but that is temporary. That is temporary. Ultimately, it is recovered in a short while, and the vision is normal, not any more problem. But when we go to the doctor, ophthalmologist, it means it's not temporary thing. It's not simple inflammation or anything else. Though we go for these things to the doctor as well, and they treat it temporarily to avoid the exciting factors, to overcome the reactions which has been caused by any other outside agents. And then ultimately, in due course, that goes, and the eye becomes normal in vision, invisible, and also in the vision. Visibility of the eye and vision of the eye. These are two things. So, visibility of the eye, if it's not red, if it's not watery, if it's not itchy, if it looks just in the middle, in the center, you can see that every person is looking to you, and the eyes are both focuses in the center of the orbits. It says normal. But if all these things temporarily, redness, watery eye, itchy eye, all these things are categorically considered as the temporary phases, temporary causes, which has caused the problem in the visions. Over excess of watery discharge, that is lacrimations, excess of something inside the eyelids, or you can say the outside of the conjunctiva. If it causes any irritation to the conjunctiva, that may also cause temporary vision impairment. But when we go to the doctor, even after all these things are not recovered in a due course, then ultimately we go to the doctors. And we go to the doctor. The question is, doctor, my vision is not good. I can. There may be foggy vision. There may be dim vision. There may be different kind of visions. I will just tell you in a moment that there are different names of the vision dimness. Dim vision is a one question, but dim, what type of dim visions? It has a different things, and depending upon the causative factors of that one. So just like doctor says, first of all, if you are not seeing normally, it means it may be age related, mostly young man, for all acute conditions, do not go to the doctors mostly. But if it's any inflammatory condition, because of the agitative factor, because of the local exciting causes of the sand, of the air, dust, all that one, that's a temporary. And ultimately, it is recovered in a due course. But when you go to the doctor explains all these things. Your one question, my vision is not good. Doctor sees there is no inflammation. Doctor sees there is no watery eye. Doctor sees there is no itchy eye. And physically, outwardly, what we see, we don't see any problems. But even then, the person says, my vision is not good. I have a foggy vision, I have a dim vision, whatever different type of things he will say. But doctor says, first thing, it may be because of age. Your eye vision is not normal because of the age. Mostly we see the old peoples are not having the same type of visions. As over time, all the body muscles, not only the eye, all the body muscles becomes weak and they cannot perform their duties efficiently. And just like in the legs and the extremities, we have tiredness in the legs, we have tiredness in the arms, tiredness even in the head. So it indicates when any organ in due course with age related causes is not fully active, is not sufficiently active as it was previously in younghood. So, first of all, doctor says your eye vision dim may be because of macular degeneration. I just now told you about the macula. The macula is a portion in the back of the eyeball. It's a yellow color. It's a yellow color portion in the backside of the eyeball surrounding the center of the eyeball, not in the center, surrounding the center. So that the light which is coming from front and going back to the optic nerve should not be flared up. Suppose if it's flared up, what will happen? By some or the other reasons, macula could not control those levels. Just like we have torch, and we have a torch, we ignite the torch and just make the torch on, and there are two walls. That light will go into two walls in a limited area, focused to the center. But if the walls are not there, then the light of the torch will flare up in a larger area. And the vision of that thing may not be quite clear as if it goes to the in a limited area which is made by the macula. So macula, you can say, makes the street of the vision, which coming from front side, going to the back side up to the optic nerve, it makes a pathway, limited pathway, and the light do not go out into the macula that is of yellow color. Therefore, the focus, whatever we see in front of our eyes, the focus goes back into the optic nerve in the actual position. And ultimately, with the age rate, this macula, just like an old cloth, old anything, it becomes just like the wood after a long time becomes weak. Or in the same way, clothings over time becomes shredded, and over time this macula becomes shredded over time, and it causes strips, stairs inside the macula. And if it is so, then the light which is going from front to back side will become a zigzag or irregular. And as much as it will be not going focused into backside, will go right or left in the surrounding area, it will show the similar impression to the optic nerve, and we cannot see the proper object in its real position. So, what suppose if we are seeing a bottle, we are seeing a bottle and it has its object, its figure. But if the macula is damaged because of the age factor, sometimes this bottle I am seeing here will not go back to the optic nerve in its normal existence, normal position, because the light which was taking up this focus of the bottle has been scattered into the macula, because the macula is damages. And if it's damages, or if it's a shredded type of things, ultimately the object we cannot see properly in the backside. So second thing. So first thing which comes into mind, if a person comes to the clinic and say my vision is not normal, vision, sometimes I may not, I am unable to see properly. Why you are unable to see properly? Then doctor says, okay, it may be depending upon your age. How much is your age? In younger cases, it's not possible that you have a macular degenerations. But there are some other certain conditions, just like the diabetes. There are some conditions by which the vision of the eye may not remain normal, because this portion of macula is damaged, not only age related. Even by birth, some people, some kids are having diabetes type A, and that also ultimately at length, and even when the child born at the same time, he is not having a normal vision. And if it's not having a normal visions, doctor can show because of the diabetes A type, this macula has been degenerated, has been, it's not in its normal shape, you can say. And ultimately, he said this one. Mostly in old age, even doctor says hands are up, we cannot do anything. And then what they do? They put the lens of different type of lens to focus the light at a maximum, so that it can go directly to the back side of the optic nerve, and person may feel a little better that yes, my vision is now normal. But all these things are mechanical arrangements, temporary arrangements. But mostly the doctors say that old age factors which has been changed now, it's not normal to the, just like when he was in a young age it was, and now he cannot see properly because that is the age related factor. And age related factor sometimes is very late, some even at the age of 80, 90 years of age, people can see normal. And on the other hand, I'm telling you, if a person is suffering from diabetes A type especially, a child may have the degeneration of the macula. A child may have a macular degenerations that may cause dimness of vision. And also there are other causes, that he may have weak muscles. All the six muscles we have just described will have weak muscles, and those weak muscles may cause problem in the vision for the focus of the eye. Other thing, when we are talking about the age related things, the other second point, the first point was macular degeneration, mostly in old age, but sometimes may happen in the early age because of diabetes. If a person is having diabetes A type, he may have macular degenerations even before he becomes old, at young age, even you can say. After that, the second thing is cataract. I have described you about the cataract. Mostly people call it motiabind. And sometimes, sometimes because of just like whooping cough, just like forceful vomiting, all these things sometimes may cause cataract, may cause this kind of conditions because mostly diabetic peoples have cataract type things. Glaucoma, mostly glaucoma, they generally suffer in the old age because whatever changes has occurred in the cells of the eye, the similar type of changes occurred in the whole of the system, but that system is still working reasonably normally, but eyes, even with the smaller consultation damages to the macula, cannot see normally. Even the smaller defect will not provide you the proper vision in this way. So, diabetic persons may have, even at the younger age, glaucoma, or the diabetic persons may have glaucoma at a long run of his life, even in old age, even not in old age. Before that, they may have this type of glaucoma and dimness of visions and sometimes blindness. This is called cataract and or glaucoma, and sometimes the condition uh, rarely rarely occurs in pregnant women, in you can say diabetic peoples, even at early age, that they do not have a normal vision. And in normal vision, the cataract, if it's because of the cataract, though cataract indicates a universal change in the tissues of the body, but changes in the tissues of the eye are more prominently producing a sign and symptoms, problems for us, for the visions, so we recognize it. In this way, the diabetic persons may have a vision problem even if they are not old enough, young age even. But one thing I would like to tell you, most of the people you might have heard that they are saying he is having uh, mot- black cataract or motiabed. Sometimes people call it motiabed, black, kala motia. It means that that person may have some other problems, just like vomiting, forceful vomiting, just like sneezing, just like whooping cough. A strong, violent paroxysms of the whooping cough may produce hemorrhage, and also those persons who are taking a regular medication. I think this is concerned with all most of the people who are taking blood pressure medications. And with the blood pressure medications, doctor do prescribe blood thinners, whatever kind they prescribe, Plavix, aspirin, whatever. There are many more things. So, if they are taking any blood thinner, and if he is having this kind of positions of sneezing, of coughing, of jerking, he may have rupturing of the blood vessels inside the eyeball, rupturing of blood vessels inside the eyeball. And at that condition, that oxygen, just listen what happens. The oxygen from the oozed blood inside the eye is sucked up, and there remains excess of Malpighian layer, dark, just like if the blood is oozed outside, after some times you will see it's not red, it's brownish, black, clot. In this way, if anything happened by forceful vomiting, by forceful jerking, by forceful coughing, all that one, and if any small blood vessels in the eye has been ruptured and the blood has been squeezed by the tissues backward again in the system, but still the residual portion of the content of that blood, means blood cells, all that one, that becomes black and bad conductor of light. Good conductor or bad conductor? Good conductor means which is susceptible to the light, which is more susceptible to the environment. But if someone is not susceptible, that may cause the problem. So, in this way, whooping cough or any jerking movement or any jerking thing, especially during pregnancy, if she is having blood pressure and taking medications, sometimes lady may have bleeding inside the eye. And when there is a bleeding, because inside means there is a, in the conjunctiva, underneath conjunctiva, there is a fluid. In the, you can say the cornea, there is a fluid. All these things has fluid. But if that fluid, that's a transparent fluid. Person can see through that one. But if that fluid has become dirty with oozing blood, and the oxygen has been taken away from that one, and there is a scar formation inside, light is not transmitting through that. And if the light is not transmitting through that, that is called glaucoma, kala moti approximately. These are the name which is given to that one. And that's also a cause of vision dim. Weakness of the muscle may be caused by any causes. Deficiency in diet, minerals, vitamins, and all that. Weakness may be caused by birth due to some other defects. And a weakness of the muscles in the eye may be caused during delivery times if the excess pressure has been put onto the skull when there was a delivery, and ultimately there was a bleeding inside the eye chambers. And when we measures the eye vision of a newborn child, we see child cannot see. And ultimately we say in the beginning of his life, he is blind. He cannot see. He may have blind eyes on both sides or on one side. But this is a condition. This is a serious condition. That because of why, what are the reasons behind that? We have to search it out. Is it due to spasmodic conditions? Any type of spasms which affects the head may cause this kind of conditions in the eyes, means motia or kala motia. And the cataract, I told you, chita motia, whatever it's called, I told you that the ingoing substance, liquid, serum, whatever, from the system of the person goes to the eyes, and function of the eye is damaged, or this substance which is not clear now, which has mixed blood in that one. Ultimately, when it reaches over there, it do not allow the light to pass through it. And if it's not allowing the light to pass into it, ultimately persons are declared as by birth blind. By birth blind, or this condition can happen from the injury during the delivery, injury to the skull. If they delayed delivery, late delivery, because one of the other causes, because I have told you about many of the causes which may delay in any position of the labor. But if it has happened and because of that delayed labor or pressure exerted on the skull during labor may cause internal bleeding, and that internal bleeding may cause the blindness, other than the diabetic persons. But mostly, if mothers are having diabetes, gestational diabetes means she was not having diabetes before that, but now she's having diabetes during pregnancy, whatever, maybe before or maybe after. But at that time, she is having diabetes, and all these systems are under control of that diabetes. That when it exceeding its limit, ultimately there may be rupture, or there may be formation of the cataract, or after that there may be rupture of any blood vessels which is oozing inside, and this transparent membrane will become hard and blackish in color, and that is known as glaucoma. Vision is not normal. So in this way, we have to find it out what are the causes which can cause dim vision in old age and also in young or even newborn. The common things which are termed to explain the upper thing, just like the cataract I have told you, just like this macular degeneration I told you. Other than these, there may be a common name which is mostly told by the doctors, that is amblyopia. Amblyopia. Mostly the doctor termed it as lazy eye. Just like a person is lazy and you tell him to do this and that, but he will do one thing and after that sit on carefully. No, I cannot do that. I'm busy. Even though he is playing, but I'm busy. In this way, eyes can eyes can come up to this stage because of overstrained, because of any physical conditions that eyes refuse to see. Lazy eye do not see the whatever the objects are in front of the eye. No color. In this way, this amblyopia is considered as lazy eye. Or this lazy eye, it's not that sometimes newborn babies, if they are blind, they may be blind from both eyes. But it may be in one eye. It's not hard and fast rule that every person who is suffering from amblyopia, lazy eye, weakness of the muscles, may have both side affected. That both the eyes are affected and both the eyes are not having normal vision. And this lazy eye may start in childhood and even later at any age when eye muscles are relaxed. They are not tight up normally. They are not tight up sufficiently to make the eye focus exactly in a normal way. And when this condition happens, Sometimes it may start at any age. And if it's happening in the newborn babies, it means the causative factor was either sugar A type or injury caused during the labor to the skull, especially to the skull. If the skull, if not broken, if it has been damaged by pressure on the skull, then there may be dim vision because of the amblyopia. Structure is not normal. It was pressed upon. Though there was a little bleeding outside because of the pressures, which we are unable to correct that one. In these conditions, this amblyopia may start any age. If a person is reading too much, ultimately his diet, food, whatever he is eating, is not sufficient to provide the person the proper nutrition to the eye. Under those conditions, eye may become lazy eye, easily tired. And sometimes that substances are over than the normal limits, just like the salt is over limited. And that goes inside the body, that is absorbed by the tissue and just absorbed by the tissues, even the tissue are in the eyes. And those tissue eyes are filled up with more sugar as compared to the normal condition. And if there is more sugar, ultimately that will make the eye visions, eye fluids thick, and through which the light cannot pass. Light cannot pass. Bad conductor of light. So bad conductor of light can happen any times, and it is called amblyopia. And if it's happened in childhood, it may be because of the mother was having this kind of conditions. And now he is allowing to dim vision to any persons. Second thing, I'm talking about the common ailments. Common ailments, just like I told you, cataract. Macular degeneration is a not common thing. That thing is mostly coming up when a person is having injury, when a person is having a diabetic tint, when a person is having sometimes autoimmune diseases. In this condition, there may be damages to the macula, and then there will be a weak vision. This may happen. And amblyopia, I told you, it's a weak eye. The eyes are tired. There's nothing like diabetes. There's nothing like any other conditions. But overuse of the eye make him tired. Then sometimes we just need simple rest, none other medications or no any other things, but just the rest of the eye can improve your visions if it is because of this one. So if child is born, the lady is exhausted, and even the eyes are exhausted, he do not want to see. Or even if see, he cannot see the clear vision. His eyes are not focused to the proper position of the eyes. Then at that condition, if your you can say the eyes or the cell of the body, you can say the cell of the bodies are having normal content, not excessive the sugar, not excessive of salt, not excessive of anything, then ultimately it may recover. But if someone is having excess of salt in his body, that may accumulate water, that may cause cataract type of things due to the concentration of that water, which has become concentrated because of the salts. So excess of salt may cause blindness, may cause dim visions in any persons. And second thing, you can say this is strabismus. This strabismus, generally, this strabismus is you can say, this is also known as misalignment. misalignment. Because I told you there are six muscles which makes the eyes focused in a center. Keep them in a center. Maintain their structural position inside the orbit, real positions. And if that real position is not maintained because of these muscles of the eye, then ultimately he may have strabismus, and that strabismus may cause dim vision in any of the persons. That is why we should be careful during pregnancy. We should be careful when you are okay with the delivery periods and all that, or you are not having any condition like whooping cough, any jerking positions, any jerking disease, just like whooping cough, just like tetanus, you can say, spasmodic convulsions, any type of spasmodic convulsions may cause this kind of conditions, that the muscles of the eyes are not working normally, and there is a strabismus in the eye muscles, and eyes are unable to see normally in these conditions. In this way, you can say, when one side of muscle is weak, the other side, sometimes the people, doctors prescribe patches. Those patches forcibly packs the eyeball, or sometimes just like uh, mm, you can say, we do the cataract surgery, or we do the laser surgery for the muscles of the eyes. That may cause the problems here if the muscles are not normal, if the muscles are weak because of overstrained body. In this way, patch temporarily relieves your conditions, but be sure, whatever was causing it, after that, normal diet, everything is assimilated, all the minerals, vitamins, and everything has been provided normally to whole blood, to whole body parts. Then ultimately that we may recover from its conditions, from its dim vision, you can say. So in this way, you can say the strabismus. I just talk about the strabismus. The strabismus is, again repeating, when the eye is not focused into its normal position in centralized positions, then vision may be dim, and that dim vision may be, you can see his eyeball from front of them, inward, still, and outward, exotropia, bahar, outside. So there are different conditions. What muscle is damaged, the other muscles will pull the eye's focus to his own side. The other side will remain the same. In these conditions, eye vision is not cured. So there is a reference for the treatment. So I will tell you, because today my time is over. I will tell you the treatment, what to do for all these conditions. Just like I told you, macular degeneration, cataract, diabetic retinopathy. Already I told you, glaucoma. I already told you, and the common of all these things, mechanically, because of this thing, what happened inside the eye, that is known as amblyopia and strabismus. And about the amblyopia, I told you, this is known as lazy eye, weakness of the eye. All other things are normal, but even then the standard is not maintained. A person has passed at 33% out of 100, but we consider it normal. Okay, he passed. but a big range is still left. And that condition, when happens in the eyes, we can see, but we cannot see the whole things. We cannot see the normal things. It means there are some problem that the muscles of the eye are not focusing it in its position. And that is why the vision is not normal. Misalignment. The other thing is used by this one, misalignment. Just like if tire rim and tires of the car are not focused, are not maintained in a normal position, ultimately the dim vision will go off. We will not send this one. So today's time is over. I'm your host, Gurdeep Singh Sandhu, homeopathy consultant. So today we have discussed most important reasons behind the dim visions. And dim vision, it may occur in early age, it may occur in old age. And there are some this type of factors that are responsible for the dim vision of any age: macular degeneration, cataract, diabetic retinopathy, glaucoma, amblyopia, strabismus, and misalignment. So all these things we have discussed today. Uh, will give you the treatment side tomorrow, that what should we do for the treatments in these conditions, and it depends upon the age to age. So Rabaraka, my clinic address is 9701 Sarah and Court, Dublin, California 94568. Phone number is 408-687-1899. Email address is homeomedicine@yahoo.com. Anytime if you are sick and you want to take a second opinion of your disease, of your treatment, and you are tired of any treatments, you can call me for the proper second opinion, or as well as if you want to be treated with homeopathic system of treatment, scientific approach to your health, to your sickness, you can call me at 408-687-1899. You're, I thank you for that one, and I hope you will enjoy these lectures, and you will convey to the public as well, so that other people can listen all these programs from Sabarang radio stations. They can download the app of Sabarang radio stations in your phones, and also if you go to tune in, you can listen this radio station in your cars when you're driving anywhere in the world. Tune in sabrangstation.com. So sabrangstation.com is the link of this radio station, sabrangstation.com, and you can listen it anywhere if you go to tune in, and tune in will show you Sabarang station over there. So you can listen all these programs, you can see all these programs in the phone, or also in the cars you can listen all these things. Facebook, YouTube, all these are relaying all these lectures for the general public, so that every person, whosoever is listening all these things, whosoever is seeing me on the Facebook and YouTube, they can be aware of any problem of your body, even the eyes. Rabraka will see you tomorrow at 5.